So, Lori, what we're going to talk about now is having your arm in a good position, actually your whole body in a good position, so it doesn't uh, get stuck in any one place. After a stroke, a lot of times people will be in a posture where the fingers are curled, the wrist is curled, the elbow is pulled into the body, and the arm is also pulled into the body. And people spend all day and night in this position. And unfortunately, then they get stuck there. So what we're going to talk about is all different strategies for keeping this arm and actually your whole trunk and hips and feet in good position. Now, right now, you look perfect. You have a very nice tall posture. Your feet are on the ground. Your knees and hips are at 90 degrees. This all looks good. The thing that I want to work on right now is getting your arm in a better spot. And what I'm going to do is have an armrest for your chair. Now at home, if you're sitting on the couch, obviously you're not going to have this armrest, but you'll be able to use a pretty large, sturdy pillow to help you with that. Now I'm going to kind of, your arm has some tone in this position. I'm going to slowly work it out into a more comfortable position, just like that. Now if you sneeze or cough or have any kind of pain, it's going to tend to want to come in like that. So this is something that takes a lot of attention day and night. Having a weak arm is kind of like having an infant where you have a 24-hour care task to do. So this looks quite a bit better. Your fingers are open, your wrist is straight, your elbow is straighter, your hand is kind of moved out away from the body. So this looks quite a bit better. The other thing that you could do from here is add, you can see the wrist is like this, but if you look at your right hand, your wrist and fingers are more in kind of a functional position. One way you can do that is to add, it could be a stuffed animal or a small ball. This is a ball of about 4 inches. So you can see the hand and wrist are now in a more natural look to it. The risk is if we didn't pay any attention to this, is the hand would look like this. And I have people come back to visit with me, 2 months, 3 months, 4 months later, and a lot of times this is what their arm looks like. So it's hard for them to recover because everything's kind of stuck. So this looks very nice and natural. Again, you could have almost any object that's about this size. Sometimes I'll use a larger ball or just to have the fingers even more open. So if you're watching TV, this is a good position for the arm to be in. If I have a person, and we don't need to consider this for you because I can eventually get your hand to be open like this. But some people who spend all night with a hand like this, I might use a hand splint. And I'm just showing this to scare you today. So the thumb goes here. And we would have to customize this to fit you better, but this one's kind of an off-the-shelf splint. So this is what it would hold your hand in at night. Again, I don't want something like this to keep you awake at night, and there's a lot of issues with splints, but this is one alternative if people have trouble with a hand that tends to fist during the nighttime. So they might wear this as much as they can tolerate at night, and maybe during the rest hours of the daytime. So it tends to look like that. The other thing I want to talk to you about in terms of positioning is you're starting to do more and more walking, and to keep the arm, in the old days we would have a sling like this for stroke patients, which would give their arm some support, but it also kept their arm right in this pattern that we're trying to avoid. So the thing we're using these days is this sling called a Give More sling. And I'm going to put it on you just for a second, just so you can get a feel for what it looks like. It's going to go over your strong arm first, and right in there. And it's going to come across your back. And we won't stand up and kind of position it right now, but with physical therapy, when you're doing your walking, they would put this on you when you're sitting, now it's got some springiness to it, and when you stand up, it's basically going to allow your arm to do a nice natural arm swing, not keep your arm right in here. It feels supported, but it kind of, again, goes right into that stiffness pattern. But it'll allow your arm to move, but it'll also give it a little bit of upward support, so it's not feeling like it's going to fall out of the joint here. So that looks good. The next thing we're going to do is move over to the bed and show you some positioning in bed. So Lori, what we're going to do next is help you get into a good position so you can get a comfortable night's sleep, but also keep your arm in a good position so it doesn't get stuck in this posture. Now what I notice is when you are resting, your knee tends to fall out in this direction. What I'm going to do is help it straighten. And I often, if it tends to roll out, I'll put a little towel under your left hip here, just to keep the hip from falling out this way. If you have some low back pain, I'm more likely to have a pillow under your knees to kind of bend those a little bit. Sometimes people find that to be comforting. For your arm, what I want to do is get it away from the body. Again, I want the hand to not spend a lot of time like this. So I'm going to bring a fairly large pillow over and open up your hand very slowly. Again, if I moved your hand out fast, it would just maybe be painful and pull back like this. So I'm going to open up the hand, open up the wrist, and have it lay just like that. So we've got just the right amount of pillows for your head. You look very comfortable right now, and the hand is out away from the body, just like that. So that looks pretty good. Do you feel comfortable right now? Good. Now the next thing I want to show you is, you may not want to always lay on your back. I'm going to show you how to lay on both your weak side and your strong side. To lay on your weak side, you're going to bend this knee up. Good. And I'm going to help your left knee bend up. So go ahead and try to help me. Very nice. Now, you're going to reach over towards your left hand with your right hand. Good. And maybe not quite that far. It's more of a quarter turn or a third of a turn. And I'd have a pillow right there. Does that feel comfortable?
Yes.
And I'm likely to say to have a pillow right here for your right arm to rest on so you don't feel like you're over twisting this way. Now, it's hard to see, but your left shoulder is forward. It's not scrunched under you right now. And that's important. If you were laying on top of your left shoulder, I think very soon that would get to be painful. Good. Now the next thing I'm going to have you do is look up at the ceiling and roll back on your back. Good. Keep your knees right where they are. And now reach over to your left hand and hold on to it. Good. Now you're going to look to your right. And you're going to roll that way. Bring this hand over. Very nice. And let this hand rest right there. And let go with your right hand. And get that in whatever's comfortable for you. Now the point here is that this arm is out away from the body. It's not behind you in an awkward spot back here, but it's not crunched up against the chest at the same time. So does that feel comfortable?
Yes.
Good. It looks good. So after a stroke, a person can lay on their weak side or their strong side or their middle. The main thing is to get a good night's sleep and have the arm be comfortable, the hips and knees be comfortable, just so you sleep well.